So this part of the chapter will cover the mechanism of breathing. Breathing consists of inhalation, which is breathing in air, and exhalation, which involves breathing out air. Now, the difference in the pressure inside the alveoli and the atmosphere drives the exchange of gases inside the lungs. So during inhalation, the lungs expand, which increases the volume of the lung. And because the volume decreases, the pressure inside the lung decreases below atmospheric pressure. And this causes a pressure gradient, wherein gases are able to move from an area of high concentration to an area of low concentration. Now, the mechanism of breathing is based on something called as Boyle's law. Now, according to Boyle's law, pressure is inversely proportional to volume. So when pressure increases, volume decreases, and vice versa. So let's imagine a bottle with air molecules. And now if you reduce the pressure, if you reduce the pressure in the bottle, and you have, say, 10 molecules over here. So these 10 molecules are now suspended in a bigger volume. So the pressure is actually lesser because they have more room to move about. The same container, if you actually press a piston down and compress the volume, the same 10 molecules now have lesser space to move about. So it causes an increase in pressure. Okay, so keep in mind, bigger the volume, lesser the pressure. Smaller the volume, higher the pressure. So when you inhale, you actually expand your lungs. So you can feel your lungs expanding, which shows that you increase the volume inside. And when you exhale, your diaphragm, if you remember, they relax and they lessen the volume in the lungs. So the pressure increases when the volume decreases. So during breathing, you have inspiration and expiration. The diaphragm pulls down during breathing in or inspiration. So when the diaphragm contracts and the intercostal muscles contract, there's more room in the lungs and the chest expands. So you can do this yourself. So if you breathe in, your chest expands, and when you breathe out, your chest becomes smaller because the diaphragm relaxes and the intercostal muscles relax. So keep in mind, breathing is an active movement of muscles that allows passage of air in and out of the lungs. So according to Boyle's law, the pressure is inversely proportional to volume, and gases will always move from an area of high pressure to an area of low pressure, similar to movement via a concentration gradient. For example, when you open a room freshener and plug it in the corner of the room, it's initially concentrated in the bottle, but eventually it spreads across the room. The gases similarly move from an area of high pressure to an area of low pressure. So when the pressure in the chest is less than the atmospheric pressure, the air will move into the lungs, and this process is called inspiration. And when the pressure in the chest is greater than the atmospheric pressure, air will move out of the lungs, and this process is known as expiration. So let's look at that process in a little bit more detail. So the atmospheric pressure is 760 mm of mercury. At rest, when the diaphragm is relaxed, the alveolar pressure is equal to the atmospheric pressure. So there is no exchange of gases at rest because the alveolar pressure is the same as the atmospheric pressure. And then during inhalation, the diaphragms contract and the intercostal muscles also contract. So keep in mind, muscles only contract. So they, when muscles contract, they reduce the volume in the lungs. So during inhalation, they increase the volume in the lungs. So during inhalation, the diaphragm and the intercostal muscles contract, and when they contract, the diaphragm pushes it down and the lungs expand to increase the volume. So the pressure in the chest cavity drops below the atmospheric pressure. So during inhalation, the alveolar pressure drops to 758 compared to the atmospheric pressure, which is 760 mm of mercury. So during deep inhalation, the muscles expand the chest further, thereby creating a greater drop in alveolar pressure and the intrapleural pressure. So this difference in pressure basically creates an environment for exchange of gases. During exhalation, the diaphragm relaxes, so it pushes up, and the external intercostal muscles relax. So these muscles, the intercostal muscles, relax. The chest and lung recoil, and the pressure of the alveolus increases above atmospheric pressure. So the atmospheric pressure is 760. So when the lungs, the lung muscles relax during exhalation, there's lesser volume in the lungs, which forces the pressure to increase in the alveolus and in the intrapleural cavity. So air flows out of the lungs in response to the difference in pressure gradient, and the lung volume decreases as the result. And during forced exhalation, another group of muscles, namely the intercostal muscles, internal intercostal muscles and abdominal muscles contract. So if you force exhale, you can feel that you're actually forcing your abdominal muscles to contract, not just your lungs alone, thereby reducing the size of the chest cavity even more, which leads to the increase in the alveolar pressure. So due to this difference in the pressure of the alveolus and the atmosphere, gases move from an area of high pressure to an area of low pressure. So why is this important? This is important because ventilation changes in response to physical activity of the body or difference in physiology of the body. Now, the role of breathing is to release or take out CO2 out of the body, and CO2 is a gas which, when combines with water, to form carbonic acid, and this in turn becomes bicarbonate, which acts as a buffer in the body. So when there's any imbalance in the amount of CO2 we exhale, it can cause an imbalance in the pH of the body. So ventilation can change when the body's demand increase. For example, if we need to produce ATP, we produce carbon dioxide as a waste product. So this CO2 is then detected by the valves in the arteries, which send signal to the brainstem, and we are told to exhale this. Well, we tell our body to exhale the CO2 out. And for example, when we exercise, we need more energy, so we need to produce more ATP. So this demand for increased ATP increases the levels of ventilation. So ventilation can be monitored by several different ways. First, we can simply measure ventilation by counting the number of breaths per minute, and then we can count the chest belt pressure and pressure of the fall of chest. So these are two common methods which are just preliminary tests for measuring the ventilation in humans. And the last method is the use of a spirometer. So the spirometer is a device that detects the change in ventilation, and it gives us some data on inhalation and exhalation. So if you look at a spirometer, so the spirometer measures the amount of rate exhaled and inhaled by a person, and it measures the amount of rate of air a person breathes in, and these numbers can be used to diagnose illnesses in a person or a course of treatment. So the spirometer is, it consists of a device which consists of a filter, and a simpler method is when they breathe into a balloon, and you've seen people in hospitals using a little instrument in which they are asked to breathe hard. So a very simple model uses a balloon, and this balloon will be submerged in water, and the volume of air is determined by measuring the volume of water displaced in the container in which we submerge the balloon. So that's a very simplistic model that you can even use at home. But this is a spirometer which is used in the hospital. The spirometer is connected to a display which gives us the graph for the change in different volumes we breathe in and breathe out. So the spirometer gives us various measures, some of which are all of which are listed over here. And some of the important terminologies that we look for is the tidal volume. Tidal volume is the total volume of air inhaled or exhaled in a person. So they give you the instrument, and then they ask you to breathe, take a deep breath in, and then they ask you to breathe out as fast as you can and as hard as you can. So what they're looking for at that point is something called as forced expiratory volume. Now the forced expiratory volume is the volume of air exhaled during one forced breath. In a very healthy person, they exhale 80% of the air within 1 second. So in that case, FEV can be called FEV1. That means FEV in 1 second. So in a healthy person, it's 80%. So if it's anything less than that, it's either a physiological condition, like pregnancy or illnesses that can reduce the forced expiratory volume in a person. And then you have expiratory reserve volume, the number of air, so the volume of air that can be exhaled beyond normal exhalation. So when you Normally exhale when you're relaxed. You have a certain volume that you exhale. And that is called FRC, functional residual capacity. So this FRC is the volume of air left in the lungs after normal expiration. And expiratory reserve volume is the air that can be exhaled beyond normal exhalation. So you breathe in normally, breathe out normally, and then you forcefully breathe. That is called expiratory reserve volume. And the last term over here that you need to know is the residual volume. Residual volume is the volume that is always remaining in the lung. So it never ever comes out. It only happens when the lungs actually collapse. So even the spirometer gives you a graph like this, and it gives you all the numbers. And we can look at the lung capacity, which refers to different volumes of air associated with different phases of the respiratory cycle. So the first terminology over here is the total lung capacity. Total lung capacity is the volume of air in the lungs after maximum inhalation. So the maximum amount of air you can inhale is called TLC. And this is approximately 6 liters or 6,000 ml in a normal adult male. And then you have the vital capacity. Vital capacity is the volume of air that can be exchanged by the lungs through maximum inhalation and exhalation. So that is called vital capacity. So you can see that out of 6,000 ml that you can maximum breathe in, you can only inhale and exhale about 4,800 ml. And then you have the residual volume. Residual volume of air that is always present in the lungs. So approximately 20% of the total lung capacity consists of the residual volume. And this never goes away, and it only gets removed when the lungs actually collapse. And then you have the tidal volume. Tidal volume is the volume of air that is exchanged during relaxed normal breathing. And in a normal person, this is about 500 ml per breath. So a typical breathing frequency for an adult is approximately 12 to 16 breaths per minute. And when we perform physical activity, this can increase 4 to 6-fold over normal. And there are several other factors that contribute to an individual's total lung capacity and ventilation rate. So a taller person tend to have larger chests, so they have a higher lung capacity. So a taller person, if you remember, also works harder to pump blood to different parts of the body. So the other factor that contribute to an individual's total lung capacity is the location. So people that live at higher altitudes have a larger capacity to compensate for the lower atmospheric pressure. So they have a larger lung capacity. And then lifestyle. People who are overweight and tend to smoke, they have lower lung capacity than higher rates of ventilation. So there are certain terminologies of pulmonary ventilation which are important. The first one is minute ventilation. Minute ventilation is the volume of air that is inhaled or exhaled in 1 minute. And this is basically determined by multiplying the tidal volume by the frequency of breath. Now, minute ventilation is V and a dot on top. So this dot refers to 1 minute. So this is the way minute ventilation is written. So this is equal to tidal volume, which is 500 ml in a normal person, and the frequency, which is approximately 15 breaths per minute. which amounts to about 75, let's say, 7,500 ml per minute, or 7.5 liters per minute. So this is the minute ventilation. So this is almost all the air that can be inhaled or exhaled in 1 minute. Now, if there's anything less than that, it's called hypoventilation. When a person has shallow breathing, hyperventilation is when a person breathes really, really fast and hard. So they breathe too much. And the other term is something called as dead volume. So the dead volume is the space or the volume of air that does not participate in exchange of gases. So the dead volume of air is air in the conducting zone, which does not take part in ventilation. So this is approximately 150 ml, and when we breathe in, a lot of air goes down to the alveolus, but we still have some air in the trachea and the throat that do not take part in the process of gas exchange. So that's called dead space or dead volume. Now, the dead volume is important when you think of oral resuscitation. So if you've ever thought why oral resuscitation is possible, really, if you breathe into another person's mouth, if you think of it, you might really be breathing CO2, right? But the fact that we have some dead volume, we have some gases in the upper respiratory tract that is rich in oxygen and that does not take part in gas exchange. So we have oxygen-rich air in the upper respiratory tract, which we breathe into the other person's mouth, which allows oral resuscitation possible, which makes oral resuscitation possible. Because if we didn't have the dead volume, which is rich in O2, you'd really be breathing only CO2, which is not enough to resuscitate a person. And then you have alveolar minute ventilation. Alveolar minute ventilation is the actual ventilation that occurs at the alveolus. So this is denoted as VA, where A is alveolar ventilation, F stands for frequency, VT is tidal volume, and VD is the dead volume or dead space. So this amounts to about 5.25 liters per minute, which is the same as the cardiac output. So that's obviously not a coincidence. The cardiac output is similar to the actual amount of gases that is exchanged at the lungs, specifically at the alveolus. So the pressure of gases and the difference in pressure of gases is the one that allows us to exchange CO2 and O2 in the lungs, and we denote this by partial pressure. So the partial pressure is equal to the fractional concentration of the gas times the total pressure of gases in a mixture. So in the atmosphere, we have a mixture of gases, and you might not have really thought of this, but nitrogen actually makes up 78%, oxygen only makes up 21%, and CO2 only makes up 0.04%. And each of these gases exert a certain amount of pressure in the atmosphere, and that is called the partial pressure of that particular gas. So for partial pressure of nitrogen, we multiply the percentage of nitrogen in the atmosphere times the partial pressure of the atmospheric air. So this amounts to 600 mm of mercury. So this over here is the partial pressure of nitrogen in air. Similarly, the partial pressure of oxygen in air is 160 mm of mercury, and that of CO2 is 0.304 mm of mercury. If you look at this picture over here, the right heart basically pumps carbon dioxide rich blood to the lungs, and in the lungs gas exchange occurs at the alveolus. And how does the gas exchange occur, or why does the gas exchange occur in the first place? So the partial pressure of oxygen in the alveolus is 100 mm of mercury, and the partial pressure of CO2 in the alveolus is 40 mm of mercury. Now, the blood brings in gases to the alveolus, okay? And the blood that comes to the alveolus has a high partial pressure of CO2 compared to the alveolus. So right over here, the blood that's brought in has the partial pressure of 46 for CO2, and it has a lower partial pressure of O2 compared to the alveolus. And keep in mind, gases move from an area of high pressure to an area of low pressure. So at the alveolus, when deoxygenated blood reaches the alveolus of the lungs, CO2 moves from the alveolus, moves from the blood vessel to the alveolus. So it dumps off CO2 because the pressure of CO2 is high in the blood vessel. And on the other hand, O2 over here has really high partial pressure compared to the blood. So oxygen moves from an area of high pressure, that is the alveolus, to the blood vessels. So oxygen is taken up by the blood, and CO2 is removed from the blood back into the alveolus. And that CO2 that is removed is exhaled out of the body. So after gas exchange, the blood that goes to the left side of the heart is rich in oxygen and poor in CO2. So this is oxygen-rich blood that enters the heart, the left side of the heart, to be pumped to different parts of the body. Now, hypoventilation is a process where a person has very shallow breathing, and hypoventilation leads to increase in CO2 because we don't breathe out CO2 properly. So as a result, we have too much carbonic acid in the body, and we have excess. So this carbonic acid breaks down into bicarbonate ions and H plus ions. So we have a lot of H plus ions and a lot of bicarbonate ions in the body. So this leads to hypercapnia, meaning excessive amount of CO2 in the body, and hypoxia, which is lack of oxygen in the body. Okay, so when we have too much CO2 in the body, it can alter the pH of the body, which can lead to conditions like acidosis and alkalosis. Now, respiratory acidosis or alkalosis is associated with the respiratory system, and metabolic alkalosis and acidosis is associated with defects in the digestive system and the urinary system. So any change in pH can either lead to increase in pH, and when the pH goes beyond the normal range of 7.45, it's considered alkalosis. And when the pH falls below 7.35, it's called acidosis. Now, the lungs, so the respiratory system and the urinary system basically compensate for each other. So if there's a problem with the respiratory system, the kidney is the organ that compensates. And when there's a problem with the metabolic acidosis and alkalosis, both the lungs and kidneys work for compensating the difference in pH to maintain homeostasis. Now, hyperventilation is rapid breathing, and you can see when people hyperventilate, they're asked to breathe into a bag, right? That's because they have very rapid breathing, and during hyperventilation, it causes too much breathing, so we lose too much CO2, which leads to lesser amount of H2CO3 in the blood, which in turn leads to a lesser amount of H plus ions and lesser amount of carbonate ions in the blood. So this condition is called, will lead to hypocapnia, which is the lower amounts of CO2 in blood. So this can lead to respiratory alkalosis because we don't have enough CO2 in the body, which disrupts the buffer system in the body. Now, this condition is not really of big concern because the amount of oxygen in the body does not get lowered. And since we have enough oxygen, our cells are still able to function. So this is not usually a big clinical emergency. Okay. Okay, so for your purposes, just understand the differences between respiratory alkalosis and metabolic alkalosis and acidosis, and the clinical considerations associated with the respiratory system alone. Some important disorders of the respiratory system include asthma. Asthma is actually a very common chronic inflammation of the airways to the lungs, for example, the bronchi and the bronchioles. This causes inflammation, which leads to swelling and mucus production, which constricts the airflow in the lungs. So during acute asthma attack, the bronchi, the smooth muscles, get constricted, and it causes a significant airway obstruction. So the person finds it really, really difficult to breathe. So when the smooth muscles get tightened, the passage in the airway gets constricted, so they become lesser in volume. So the person isn't able to breathe in and breathe out properly. So the common symptoms of asthma attack include shortness of breath, tightness in the chest, wheezing and coughing. If it is left untreated, it can be life-threatening, but the common triggers can include environmental factors like allergens, smoke, excessive cold, certain medications, or dust, or insects. Then you have emphysema. Emphysema is the destruction of the alveoli of the walls, so the walls of the alveoli, and this is a result of long-term irritation of the lungs. For example, chain smokers end up having emphysema due to excessive smoking, or people who live in a highly polluted area can have emphysema due to prolonged exposure. So when the walls get destroyed, it leaves lesser surface area for gas exchange, because keep in mind, alveoli is the actual site of gas exchange in the lungs. And then chronic bronchitis, which is an inflammation of the bronchial tubules that lead to secretion of mucus, which causes obstruction of the airway. So the person may have severe bouts of cough for prolonged periods of time, and this infection can last for a very, very long time. So the symptoms include shortness of breath, wheezing, cyanosis, which is turning blue, and hypertension. Some other conditions include eupnea, which is not a condition, it is just the normal breathing, which we call eupnea. Apnea is a temporary cessation of breathing, and dyspnea is labored breathing or shortness of breath. We talked about hyperventilation and hypoventilation, and then you have atelectasis, which is basically collapse of the part of all of the lungs, which can lead to airway obstruction. So this happens due to several different conditions of the lungs. Some other conditions which you probably have heard of include tuberculosis, which happens due to an infection due to a bacteria known as Mycobacterium tuberculosis. They do a bubble test for this, so they inject you with the tuberculin protein, and then if you get a bubble, you test positive, and you actually have to go in to get the bubble measured. And then you have mesothelioma, which is a cancer of the pleura of the lungs. It is and then you have pulmonary edema. Pulmonary edema is abnormal accumulation of fluid in the interstitial spaces and the alveoli due to increased pressure of the pulmonary cavity. Then pulmonary edema can be caused due to a lot of different reasons, either due to a defect in the heart, so the fluid backs up in the lungs, or it can also be caused due to infection of the lungs. So with this, we have completed the chapter respiratory system. So thank you.